Hey, Dr. O, what are the major ethical considerations of offering telehealth therapy to my clients?
Hey students, Dr. Owens here. Today I'd like to talk to you a little bit about the ethical considerations when using telehealth, which can mean anything from emailing a client all the way up to fully conducting a session using a telehealth platform when you're not in the same physical location as your client. So let's get right into it. First topic, starting a telehealth session. There's a few things that we might need to do when we start a telehealth session with our client, meaning we are using something like a HIPAA-compliant electronic health record platform to have a virtual meeting with our client. The first thing we do is confirm the physical location of our client, ensuring it's the address we have on file or noting down the address if it's a different address than what we have on file. We do this for a couple of reasons. One, we want to ensure that we are legally able to provide services where the client is physically located. And we'll get to more of that in a second. Two, we want to have a physical location for our client should there be an emergency and we need to follow up with the client. All right, the second thing we do when we start a telehealth session with our client is we provide a 360-degree view of the room that we're located in to ensure our client that the information they are sharing with us will remain confidential and is only being heard by us. We also ask our client to go ahead and provide a 360-degree view of the space that they are within so that we know that they're in a confidential location and we can provide them some psychoeducation about finding and securing a confidential location if they're not currently in one. Okay. The third thing we do is make sure that we have an alternative way to contact our client. Unfortunately, it is still common for us to have glitches and drops in services when we're conducting a telehealth session, and therefore we need to have another way to contact our client, ideally a phone number, so that we can call them and continue the session or close out the session if we happen to lose Wi-Fi or they do. All right, let's talk about originating and receiving states when you're providing therapy services through a telehealth platform to a client. The originating state is talking about where the services are coming from. So that's where you are physically located. I'm physically located in Florida, so that is my originating state. The receiving state is where my services are going. So that's where my client is physically located. If I'm licensed in Florida and my client is physically located in Florida, then we're all good. The originating state and the receiving state is the same. But what about if I'm licensed in Florida and my client is located physically at this point in time in Kansas or California or Pennsylvania? Can I provide services to them? It depends. You may provide services across state lines, so into another state, when one of 5 conditions are met. The first condition, you're licensed in both states. So if your client is located in Kansas, you're located in Florida, and you are licensed in both Kansas and Florida, then you may provide services into that receiving state. 2, there's a state statute. So some states have state statutes that allow temporary practice by a counselor in another state for a period of time. So if your client says to you, hey, I'm also a Florida resident, we're doing telehealth, and then they explain they're going to go to Chicago for 3 weeks to visit family, but they would like to continue to have telehealth services because this is going to be a stressful visit. And you say, I think that's a great idea. Let me check on the requirements in Illinois so that I can see if I can provide those services. So if there's a temporary state statute, and then you let your client know from there. 3, if there's an executive order that temporarily relaxes or eliminates the requirements that the clinician be licensed in the receiving state. This happened in a lot of states during COVID-19 and can happen during other emergency scenarios where we want to make sure that clients are able to access counselors and there may be more access available if they come from outside the state. Okay, number 4, it's a closed system. So if you're providing services, for example, in a closed federal system like the VA or a prison system, then often it is not necessary for you to be licensed in the receiving state. So check with your supervisor on that. And then 5, if you have a interjurisdictional compact. Right now, PsyPact is the interjurisdictional compact that is for psychologists. I hold this credential. It allows me to treat into any state that has enacted PsyPact legislation. But counselors, it's coming for you too. So the Counseling Compact has been working hard at enacting legislation in many, many states. And 2025 is when they say they will be starting to receive applications. So not quite there yet, but should be there really soon for licensed counselors to be able to apply for this additional credential. And that's sort of key. An interjurisdictional compact isn't profession-wide. You still have to apply for and receive the credential and keep that credential active on an annual basis. All right, let's talk social media in therapy. You need to have a social media policy if you're a counselor, therapist, or psychologist. This should be in your informed consent, and it should explain the ways that you do and do not use social media. So if you are a therapist who uses social media to provide information to clients, potential clients, and the general public, that needs to be outlined in your informed consent. And the limitations of that also are outlined. In other words, you're not able through social media to diagnose or provide individualized psychological services. Okay? So the information is for educational purposes only, for example. Another key thing about social media is that for therapists, counselors, psychologists, our clients' privacy is absolutely paramount to us. And we receive all the information that they intentionally provide to us and no information that they don't intentionally provide to us. So when a client comes to see you, we do not do any background research of looking a client up on social media. Instead, we listen to the information that's provided to us. We do not follow clients on social media. We do not request that they follow us. Those could all be potential boundary violations. Of course, if a client brings their device into session and would like to show us something that they created on social media or an interaction that they had on social media that was problematic, they may do so because that's information they're intentionally providing to us. All right, let's talk email and text. Even if you aren't using social media for anything and you are not providing telehealth services, I bet that you may at some point have a client request or have a need to email or text a particular client. So you want to explain the boundaries in your informed consent process as well as in your informed consent documentation about emails and text messages. You want to talk to them about the risks of unencrypted emails. And often therapists will only use emails or text messages for the purposes of scheduling, right? Canceling or rescheduling an appointment. Because in most cases, those are not going to be HIPAA compliant forms of communication. Instead, if we need to send our clients something or communicate something with our clients in between sessions, we want to ensure we're doing it with HIPAA compliant communication, which is often through the use of an electronic health record system that allows us to securely message our client, where they simply receive notification that there's a message in their portal and then they have to log in to see that message. So we're not sharing private health information with them without those layers of security for them. In order to ensure something is HIPAA compliant, we also have to enter into a business associates agreement with them. So you will see a BAA as a common piece of sort of the EHR onboarding paperwork should you choose to use one. All right, let's talk security. So if you're going to connect using a telehealth platform to see your client virtually, you want to make sure that that telehealth platform is HIPAA compliant. Okay, so it has the extra security involved to ensure it's HIPAA compliant since you'll be discussing private health information. You also need to make sure that you have secure Wi-Fi, right? That you're using secure Wi-Fi, which is password protected and encrypted in order to join the session, and that you suggest that your client does the same as well. What if you you want more information, right? The American Counseling Association, Section H of the Ethical Codes is all about telepsychology and telehealth. And there it talks about considerations for informed consent, for the risks and benefits. We talk to our clients about the risks and benefits of using telehealth. Of course, it can be very convenient for our clients. There can be some drawbacks, maybe, or limitations of it, right? So eye contact can be one of those things. Missing nonverbal cues can be one of those things. Lack of synchronicity between verbal information and video can happen and can interrupt therapy sessions. We're going to talk to them about that and how they might feel about those things when they happen and how we would address them. We want to talk about confidentiality, and there's some additional extra concerns about confidentiality when we're using telehealth. So we explain those things to them, how we use email and text messaging and why we show them a 360-degree view of our therapy office when we connect, and why we ask them to do that for us as well, and why it's important to have password protected Wi-Fi, for example. We want to make sure that telehealth is appropriate for the person, right? So depending on age, diagnosis, or clinical considerations, and their own facility with technology, it may or may not be appropriate for the use. Sometimes it's very young, sometimes it's very old, sometimes with different clinical issues. And so we monitor that and make sure that we're competent to provide the services and they're capable of receiving the services that way. And that is a part of making sure that services are effective, which is also covered in the American Counseling Association, Section H. So those are just a few quick things to get you started with some of the ethical considerations we have when we're providing counseling through telehealth. Thanks for listening.